Choosing the right orthopedic surgeon can be very stressful, and making the right decision can be the most important one you make. We spoke to Dr. Erik Zeegen at Valley Presbyterian Hospital in the San Fernando Valley. He gives us his advice on this decision.
The best way to choose the surgeon for your surgery would be to do your research. Talk to your primary physician, other physicians in the community, other patients that have had surgery with a particular surgeon. But you want to find somebody who has a lot of experience in doing hip and knee replacements. We have studies that have demonstrated surgeons who do more than 100 knee replacements or 100 hip replacements a year have better results than surgeons who do, say, less than 50 a year. So just like anything, practice makes perfect. You do a lot of these, you start to really get very good at it.
Dr. Zeegen discusses the lifespan of these hip and knee replacements.
Historically, the implants for hips and knees, we would tell people are going to last about 15 years. But we now have newer generation implants with better plastic that has better wear characteristics, where we're extrapolating the data to suggest that these may last 20, 25 years. But that's provided that people take good care of their joints, meaning they're not out doing a lot of high impact activities, things like running, jumping, kickboxing, anything that's going to really have a lot of impact on the joint. So that's an average. But things can happen that can cause the joint to wear out prematurely, besides just activity related phenomena. Things like if the implant was not put in optimally. The three most common reasons would be pain, instability, or infection. Those are usually the most common causes. Loosening would be another one. But any of those things can cause an implant to fail and need to be redone.
I had a metal-on-metal hip replacement, which has been known to create problems, and it's been in the press. And I went to Dr. Zeegen to have it repaired, essentially. I didn't even know what he was going to do, possibly replace it, repair it, but something needed to be done because I wasn't functioning correctly.
Manel tells us how she's doing now after the surgery.
I'm doing pretty well, I actually stayed at my parents' house because it's one level for 6 weeks until I got the all clear from Dr. Zeegen to do stairs. And now I'm at home in my townhouse with 2 flights of stairs and I'm doing the best I can. I'm doing pretty well.
Some revisions are as simple as going in and just changing parts that are what we call modular, that can snap in and snap out. The parts that are grown into the bone are well fixed and we don't have to do anything. That's a pretty straightforward revision. Then you can have things at the other end of the spectrum where everything's loose and there's bone that's missing and soft tissue defects, and you really have a more challenging case on your hands. We're seeing conditions now that maybe weren't around a generation ago, because as a lot of patients who've had hip and knee replacements earlier in life are now getting to an age where they're having 1, 2 revisions. So now we're dealing with a situation where you sometimes have a femur where you've had a revision hip above and a revision knee below, and now there's not much bone in between, and that can present a whole new challenge that didn't exist a generation ago. But we have lots of good implants these days to meet those challenges and get the joint back to the condition that we want it to, so that patients can get back on to a very active lifestyle.